Our special segment tonight, X-rays. X-rays can help save your life, but they can also endanger it. 7 out of 10 Americans will have some kind of X-ray this year, more than 150 million people, and some of those will cause problems. There is also a growing body of opinion that there are too many X-rays being made. The director of the Bureau of Radiological Health of the Food and Drug Administration said today that in his view, 30% of all diagnostic X-rays by doctors and dentists are not necessary. John Hart has been looking into all this.
You ought to be in pictures.
The theme song for this government film made for public education in precautions for being X-rayed is "You Ought to Be in Pictures." There is strong medical opinion that X-rays are not the kind of pictures you ought to be in unless absolutely necessary.
We know that all X-rays are potentially hazardous.
Some of the radiation entering the patient's body is going to interact with body tissues and has a potential for changing the atomic structure of those tissues.
In this government slideshow made for the education of X-ray technologists, some potential changes are described.
Human data is available which implicates ionizing radiation as a causative agent in leukemia as well as cancers of the skin, bone, lung, thyroid, and breast.
No one knows how much radiation it takes to induce these changes or even why some people get cancer and others don't. A large portion of the X-rays taken are medically necessary. Lives are saved every day. Parts of the body are salvaged. And X-rays give off small amounts of radiation. But since, as the government lecture tells the technologists, damage from radiation can be cumulative, and since any amount may produce some injury, the smallest possible dose and the fewest possible exposures reduce the hazard. There are 250,000 X-ray machines at work in the country. Only 1/2 of the people operating them are certified by the American Society of Radiological Technologists.
In many offices around the country where X-rays are being taken, the individual who's taking them may be a secretary, or maybe a nurse, or a receptionist, and may have had no formal training in radiologic technique or in the physics or biology of radiation, and therefore may not know what safeguards are necessary.
Only 10 states require operators of X-ray machines to be licensed. Only one of them, California, requires all X-ray operators to pass a state examination. There are two kinds of people well qualified to take X-rays: certified technologists who have 24 months of training, and doctors with 3 years of training after medical school who then become radiologists. While other doctors, specialists, may acquire skill in taking and reading X-rays in their specialty, Dr. Dieter Schellinger, Chief of Radiology at Georgetown University Hospital, says the average doctor coming out of medical school is not prepared to take and interpret X-rays.
No, I definitely would say no. Our medical students who graduate in our medical school usually have a 2-week rotation through our department in their 3rd year, and that is all.
A study of medical practices shows that doctors who take X-rays on their own machines in their own offices take twice as many X-rays on the average as radiologists do, exposing patients to more radiation. The director of the Bureau of Radiological Health told a House committee today nearly 1/3 of the X-rays taken in this country are medically unnecessary. Part of that, said Director John Vilforth, are the millions of exposures that are botched by unskilled operators and must be repeated.
If 30% of X-ray examinations are indeed unnecessary, the savings occurred by eliminating this would amount to approximately $2 billion annually.
Under present law, there's no way for the federal government to require licensing of X-ray operators or to regulate X-ray use by doctors, nor is there much inclination to do so. About the best thing patients can do is to write the Food and Drug Administration for a list of questions to ask their doctor before receiving diagnostic radiation, and to check the credentials of the person pressing the button. John Hart, NBC News, Washington.